So our overall approach with lasers and skincare is it's not one or the other, Or when we see a patient that comes in who has neglected their skin for some time, the first approach is to truly look at it as a corrective phase of their treatment. What we're trying to do is erase years of sun damage and aging and all that kind of thing that has occurred that is creating a dull, less vibrant looking skin. We break it down into a corrective phase. There's certain treatments, both in combination of medical grade skincare that's applied, as well as lasers or chemical peels. So we use this combination to correct skin. Then once we've corrected the skin and we have the skin where we want it, the next phase is maintenance. Maintenance requires a lot less, downtime or commitment, but it requires a patient who's willing to do things on a regular basis. Every few months doing some type of a skincare peel or a laser, doing monthly or once every 2 months doing like a hydrofacial or other type of facial, as well as being committed to doing their skincare and their sun protection at home on a regular basis. The thing I think a lot of patients, especially our surgical patients, forget sometimes is just because surgery can be a major change and then you don't have to worry about it for a really long time, skincare is different. Skincare is more like your body. You can do a boot camp and get your body in great shape, but if you don't maintain it afterwards, you're going to go right back to where you were before. And the skin is the exact same way. It's an constant uphill battle with it, but you can win it using the right treatments. So lasers is a really, really dynamic part of the cosmetic industry. I mean, every other day there's a new laser that is coming out with new applications. Unfortunately, many times these lasers turn out to be less effective and less promising than what we originally hoped for and anticipated. So my philosophy and my approach has been to be patient, let the laser, the new technology be out on the market for a certain period of time, a year or two, and hear from trusted colleagues and hear from patients what their perceptions of these technologies are. So what we currently have in our practice is, I would say, the most advanced, highly regarded set of lasers that can be utilized in a practice. And we're always looking for the new laser that's coming out on the horizon and evaluating it. But as it stands, we have lasers that are used for just about every application that affects the aging face and the aging skin, and in a way that both has very little to no downtime for those patients who have very active lifestyles, to those that we can use during surgery where we can take advantage of their downtime. But at the end of the day, from things like deep lines around the mouth, we can almost erase those. Patients with a tremendous amount of pigmentation, melasma, browns and reds, all of that can be improved, ultimately creating a really bright, beautiful glow to the skin that is so synonymous with a healthy lifestyle and a youthful face.